Welcome everyone, and good afternoon and good evening to everyone from wherever you're joining us from. And welcome to our webinar series, Expert Speak, in association with IIFIS, the International Institute for Information Security. Let me give you a brief about the speaker for today, Ms. Sivani. Sivani is currently the Director of Cybersecurity Lab at GE Healthcare, and she's a proven leader with the ability to work and influence all levels of engineering, people management, product management, program management, as well as business development in the cybersecurity domain. And today she'll be covering the topic on the role of AI and cybersecurity in the healthcare domain. And one request to all the participants, please post your queries in the chat and we'll present it to the speaker at the end of the session. And yeah, over to you, Shivani.
Thank you, Ram. Happy to meet all of you. I'm Sivani. I'm working with GE Healthcare. I lead the cybersecurity lab there. The lab is a team that performs cybersecurity testing, develops tools using Gen AI, and we also do evaluation of tools and all of that for the entire of healthcare. This is one of a lab within GE Healthcare across the globe. Prior to this role of mine, I was with GE Healthcare all through my career and performed various other roles like program management, product management, and other things as well. And then there was a time when I realized that I'm kind of looking a lot at growth and not looking at what is right and how I should look at the growth in my career. And that is when I took a backseat and I thought I would want to get into the domain specific field. And that is where I chose cybersecurity. A decision I'm very proud of because this domain keeps me on my toes all the time because you learn every day something or the other. There's a lot to learn, lot to experiment, and overall a lot to keep you upgraded all the time. And that way, and with healthcare and cybersecurity, the combination is even more great, and it gives me immense pleasure to be part of this forum today, to share my experiences as well as share what I have learned all through my career with the advent of AI and healthcare in healthcare and security that I am kind of completely part and parcel of. Just to set it straight, whatever I'm expressing here is through the learnings that I have got in my career journey by working with GE Healthcare, but it doesn't represent anything related to GE Healthcare. These are all my personal learnings and my personal views, and nothing to do with my organization. When Ram connected with me and we wanted to have this session, it felt very apt for me to talk about cybersecurity and AI in healthcare because as we speak, right, AI is kind of getting too much deeper in the healthcare domain, and we are experimenting a lot. There is lots going on with AI in healthcare, and I thought the combination of security and AI in healthcare and what it is bringing on and what are the benefits that we might see in the next couple of years and what's going on right now is something very, very important for all of us to understand, not only as techies, not only as professionals, but also as an end patient for any healthcare organization, right? So it is important that we know all of those things, and I thought it is an apt topic. Like Ram mentioned, please do reserve your questions for the end of the session so that we can cover what I wanted to, but I'm very happy to be able to answer those questions. And if I'm not able to answer any, I will get back to you. I'll give you my email ID and my LinkedIn profile, and you can go ahead and post your questions to me there, and I will be more than happy to answer those questions if I'm not able to answer them or take any of the questions here during our session. I hope you are able to see me or able to see my screen. Just for the sake of bandwidth problem and all, I'll be switching off my video while I'm talking and going through the presentation. If there is any glitch in the connectivity, do let me know. So to start with, the topic for today is the role of AI and cybersecurity in healthcare. When I say healthcare, I'm not limiting myself to only device manufacturer or a hospital, but it is the entire ecosystem. The ecosystem of a device manufacturer, solution provider, app providers, and hospitals, radiology clinics, as well as a small doctor's clinic where he himself is sitting at his home and trying to check patients. So when I say healthcare, I mean the entire ecosystem, which has come together to provide or treat us or predict our problems or give solution to any health challenge that we are kind of facing today. So moving on, the first and foremost, I wanted to talk about what are the major things that are kind of shaping the future of healthcare. What is it that the healthcare organizations or anybody is kind of looking at today? What are those trends? So the first and foremost, I'll not go through all of these, but then the most important ones that you all need to know, or as an end patient also we all need to know, is that overall the fertility rate in the world is decreasing, and with technology, with care on our own health, with active monitoring and all, the average age of people is increasing. So by 2030, the prediction is that 1 in 6 folks will be an aging person. And even back home in India, we are going to have a lot more elder patients and elderly to be taken care, to take care. And the number that they're talking about is it would be 300 million by 2050, which means that there is a demand for a better care, accessible care. Then cancers are going to increase, maybe because of the lifestyle, maybe because of the pollution, maybe because of uh, how the food is being produced and all of that. But the prediction is that the cancers diagnosis will increase. The survival rate for breast cancer is also going to increase if predicted much earlier. See, healthcare as an industry is innovating very fast. But what's happening is there are a lot of clinical and operational challenges. Because for countries like ours, where the population is so high, even if there is a clinic in every street corner, they are all full. Hospitals are always full. Healthcare providers or caregivers always are pressured to look at more patients than they can. So those are operational challenges. For countries like the US or in the Europe, where the population is less, but then they have operational challenges where there is this insurance, they need help with the scheduling and all of that, because of which there is a gap between what is available, what they can do, and that is where they also take a lot of time to provide the right care at the right time. There is so because of there are so many apps like Practo, Apollo app or something else, and then there is end user app for the doctors and all of that. The doctors are spending a lot of time on the medical records. Then they should be with the patient because they are not integrated. The patient gets some digital copies. The patient gets some in prescriptions. He gets some in CDs and then some in a pen drive, and then they have certain information that their hospital would have collected when the patient comes in. So he kind of has to scramble with multiple things to check the patient. And then the most important one, when your health information is stolen, when your credit card information is stolen, your finance information is stolen, and you get to know you can cancel your credit card, you can stop that using that account, you can raise some complaints and then get some amount back. some way to get out of that problem. But with health records, the problem is that you cannot change yourself. You cannot change your health condition. You cannot change your own biometric data. Yeah, on the dark web, where a mischievous person, hacker who has stolen your data, is selling. They say that the healthcare records are $1,000 more valued than a financial data, because the data can never be changed. So once he has your data, he has it. The other thing is AI. What AI is doing is it is bringing in the much required automation into the healthcare domain, which is helping in to bring in efficiency, to assist the caregiver to be able to serve the patient in a much more efficient manner. So these are the factors that are shaping the future of healthcare. And these are the things that we are going to talk about as we kind of progress further. And this is the things that most of the caregivers, most of the healthcare device manufacturers, solution providers, app manufacturers, everybody would be talking about these, and we should be working around these problem statements. Now, coming into what are the AI use cases in healthcare? Where is AI coming in picture? You would have seen AI being used in your e-commerce. You would have seen AI being used everywhere nowadays, right? But where in healthcare? So first and foremost, diagnosis and treatment. So when we go for a scan, like a CT or an MR or a mammogram, or an X-ray, analysis of the image, where a radiologist sits and analyzes that can be automated using AI. So image analysis becomes very easy when you kind of apply AI. Drug discovery, robotic surgery, and then personalized medicine. Not all medicines are suitable to everyone, right? So personalized medicine as to, for this particular patient with these symptoms and this body condition and this kind of overall biometric data and all of that, AI can help predict what should be the personalized medicine dosage for that person. Clinical decision support as to what should be the decision. So all of you can kind of connect, right? If you are diagnosed with thyroid, so there's this particular medicine which has this 25, 75, 50, 80, I don't know what all dosages, right? So the doctor keeps trying. The same for diabetes, when there is an insulin injection provided, right? That doctor keeps trying with the dosage, and he asks the patient to write it down, and then looking at the data, he kinds of correlates and then changes the dosage, and the dosage continues and all of that. So that kind of experimentation will become automated. Excuse me. And become automated with the use of AI, and it will help in clinical decision making. Even for surgeries, when it does an image analysis and whether what kind of surgery to be done, where exactly to be done, all of that will become easier with the help of AI. Second thing is triaging. Remote monitoring. You would already have seen, right, your Apple Watch or your Samsung Watch or the other health apps in your mobile are already monitoring how many steps are you walking, what is your BP, are your sleep pattern right or not. Now, whether if those reports are sent back to your caregiver and they can provide you information, they can provide the right advice at the right time, that remote monitoring and virtual health assistance becomes even more easier. Patient triaging as to when does he need the actual intervention of a caregiver, or can he be at home and do things, is something that also can be done using AI. Administrative and operations, which you are already seeing, right? The administrative and operations work across schools, across malls, in our e-commerce. Similar workflow optimization and administrative automation, like the scheduling, billing, claims, and all of that can be automated at a very high speed when AI is used. And of course, the most important, the research and public health. I can tell you, I guess 20 years back, when my grandmother was operated for her heart surgery, there was this open heart surgery that was planned for her, and I think it is 20, 25 years back. My dad works at railway, so they had taken her to Vellore Institute of Technology and Vellore Hospital, right? I'm getting confused with the name of the hospital, but the Vellore Medical Center, and they had to be there for almost a month for her open heart surgery. After some 12, 13 years, when my sister's father-in-law got operated for the same thing, he was able to get operated at Vizag, and he had to stay in the hospital for only a week or some days, and then the post-op care was for 1, 2 months. Now, last week, my friend's father got operated for the same open heart surgery at the Narayana Hridayalaya, and the operation happened through robotic surgery. And the post-op, he had to stay in the hospital only for 2 days. And the post-op care ended in 15 days, looks like. So and it seems the doctor told them that he can even drive after 15 days. So now you can see how things are kind of getting automated, how the caregiving is becoming easier and easier, and how things are improvising when it comes to health. And this is all happening because of research, because of care about public health, right? And how do we do clinical trials? How do we predict before the actual disease? Is the most important thing that is a concern for all the healthcare ecosystem today. Now, some of the homegrown heroes, when I talk about AI and how some of our homegrown people have used AI and done something really good, right? Qure.ai. You would have heard about this organization. It already uses AI to do chest scans in rural areas via apps, and to understand whether the person has TB, and to be able to provide the care at the right time. Because India's rural, because of smoking, that BD and all of that, they get a lot of TB cases, and they are not detected at the right time, and hence it is not curable and people have to suffer. But now Qure.ai is using AI and is doing those rural chest scans and are helping. Similarly, Niramai, you would have heard about Niramai already. So Niramai it has built a breast cancer detection using thermal AI. Thermal is non-invasive, so it will not. So the women kind of get stressed when they have to go for a mammography, right? Because it is invasive, it kind of presses the breast and all of that. But Niramai's breast cancer detection is non-invasive and very affordable. And so they have used it in tier 2 cities to help the women there. That is the prediction power. And it is very much in India. And then you would have seen chatbot companions, right? Most of you would have used Practo. Most of you would have used Apollo's chatbot for booking and talking about, and the most important thing, it supports all the rural languages. So it is not made only for English speaking audience, it is made for the public health and to be able to serve the people in their own language. So now, but that is AI. Now, the other topic of mine, cybersecurity. So when we are talking about AI, when we are talking about bringing in care to your home, when we are talking about using AI to be able to predict a healthcare challenge, making it very easy for you to use the doctor, making it very easy to serve the people who are not near a big city where they can get a care. There are certain challenges, and the first and foremost challenge is cybersecurity. Are we losing our data? Is there someone who is misuse our data? Who will misuse or no, take advantage of a vulnerability in the system and cause problems? And that is cybersecurity challenges. And the first one in that is data breach. Data breach is nothing but uh, how important personal information is leaked. When your personal information is leaked, the problem is that it can land into a wrong hand, and then you can be targeted for targeted advertisements. You can be targeted by providing unnecessary calls, or you can it could lead to situations like digital arrest, or something that is really irritating and difficult. And for the healthcare provider, healthcare ecosystem, it is a financial loss, because when an end user is affected, he might file a case. He might go and write a blog. So there is a reputational damage, there is a financial damage. So any data breach not only affects the end customer, but also the caregiver, and it is not good for anyone. Insider threat. Now, insider threat is human. I would not say that somebody working in the hospital or in the clinic would do it knowingly. That chances of that is very less, but human errors. Because not everyone knows how to use their applications. What is phishing? What is what? And those errors are human error is the one which a hacker takes advantage of and uses it to put in malicious content in your email, and you kind of click it and then it causes. And today, most of the attacks in the hospital happen due to human errors. Now, IoT vulnerabilities. Today, all of us have mobile phones, all of us have smartwatches, and all of us use them without having the basic knowledge of cybersecurity. And these bring in with their own vulnerabilities. And a lot of security challenges, and some of these technologies, because of people you not using it right, or connecting it with public internet and all of that, is also a prime target for security attacks. Now, moving on, what are the real world challenges that the world has seen today? Now, so in 2024, there was a hack at a US clinic which halted chemo sessions. Now, think of it, a cancer patient, a patient who is most vulnerable, and you kind of cannot treat him, and he might be needing it at that time. And it was all halted because there was a denial of service attack, ransomware, and they were not able to do anything. All of you must already know about AIIMS Delhi's outage, right? There were like 10K patients that got impacted. AIIMS Delhi is the most busiest hospital in India. And when that gets impacted, it is like a lot of people in limbo, not knowing what to do. I told you, right, the ransomware. When I say ransomware, it is like what hackers do is that they take control of the system, and you're not able to use the CT system or an MR or an X-ray or a clinical EMR, or the system where you kind of take the patient details to be able to schedule the scan, any system. And then what happens is they ask for a ransom, either in money or in Bitcoins or something. And India's hospitals face weekly probes. It is 4 times the norm. And this could be nation state attack, it could be some hackers, it could be anything but healthcare, because there are a lot of hospitals which use legacy systems. They are more prone to cyber attacks. The US Department of Health, right? They have told that as of April 2025, there is 39 incidents affecting hundreds of thousands of individuals. And in the first half of 2025 itself, there are 29 million individuals who have been impacted already because of healthcare cyber attack, which is a very, very big number. And this is only for the US. Now come back to countries like India or others, it would be even more. Now, as we connect up, and now the healthcare with COVID, with and with remote connectivity, with bringing in efficiency to be able to serve the poor or the people in the 2-tier and 3-tier cities, it is important that we have internet connected more medical devices. But as you connect to internet, the threat surface increases. And then even the MRI, CT scanners, all of these are getting impacted. Ransomware attacks are really, really on the rise, where they kind of ask for money. So AI, as I mentioned in my previous slide, right? AI is trying to become a force to be able to detect threats, not only related to, not only AI is able to provide efficiency and operational excellence, it is also being used to be able to detect these threats, these cyber threats. And also it has automated a lot about the response. Using AI, how do we quickly respond? How do we detect and how do we respond to cyber attack? But enabling a proactive defense in healthcare sector. is also very, very important. You cannot be only reactive, but you have to be proactive. And that is where the current CISOs of the healthcare providers are concerned about, as to how do we move into a proactive defense than a reactive one. And that is where most of the organizations are focused at. Now, countermeasures like AI-based tools. There are a lot of AI-based tools today that can enhance the detection. Like I can give you an example. If a wrong actor is trying to log in and he's trying multiple combinations of passwords to be able to log in, what the AI can do is it can detect that this fast. If somebody is trying to log in more than 4 or 5 times, it cannot be a human. So it will go and give a warning so that the hospital or the IT department or someone can take an action and see that something is going wrong. Similarly, if there is a lot of traffic coming in from some IPs, the AI-based tool can detect that and it can stop it. Similarly, enhanced protocols, strengthening the security protocols and helping safeguard sensitive healthcare information can be done through UI. AI. And similarly, professional training, continuous trainings. Today, you don't have to invite the entire hospital staff into a room and give them training the entire day. AI can give those trainings. Those trainings can be given in the local language for those people, so that the staff knows. And I told you, right, human error is the biggest reason for ransomware attacks today in healthcare sector. So these trainings about cyber awareness, about how to use the device, what are the do's and what are the don'ts, they are all tailored on the local language, tailored in the pace that is needed for that particular area. Using AI is something that is helping a lot in the countermeasures of cyber attacks. Now, AI-powered intrusion detection systems, threat intelligence platforms, safety awareness trainings. These are really, really some things that are kind of helping avert a lot of cyber incidents that we could have not been able to avert if not using AI, because AI kind of can do things which a human cannot do with his normal cognition, right? And that way, the AI-powered intrusion detection systems, threat intelligence platforms, and all of that have helped avert a lot of cyber incidents. Now, coming to the synergy of AI and cybersecurity, right? How do we together, how AI combined with cybersecurity in healthcare is able to provide the care? So, what is happening is it is providing a vigilant, a very adaptive defense, and letting people innovate. Because when you use AI, you have to connect to the internet. You have to be on cloud. The moment you are connecting to the internet, you are on cloud, your threat surface increases, your chances of cyber attack increases. But with the right cyber defense, that again uses AI is able to help you let the innovation be done in a free manner. And that is what is kind of transforming the healthcare ecosystem overall. So when I say healthcare is currently working on two particular uses of AI. One, using AI for prediction, for drug detection, for introducing operational efficiency, administrative efficiency, image analysis, remote care, patient care, virtual assistance for the people, predicting any healthcare problem so that he can be treated at the right time, drug discovery and all of that. And then again, healthcare is also using AI to come up with intrusion detection systems, to come up with threat intelligence platforms to be able to avert any kind of cyber incident, and also to be able to provide the right defenses targeted to the right set of clinics, right? There are certain clinics which are big. They need bigger intrusion detection, bigger threat intel, bigger cyber defenses, whereas a smaller clinic with lesser instruments might need lesser. So it is very important that healthcare innovates in that front, and that is where the energy is going today. And this synergy of AI and cybersecurity is able to give the freedom to innovate in the healthcare domain for the public good. And this duo of cybersecurity and AI today is being used for compliance with laws. And when I say laws, there are multiple laws. Ethics when you use AI, no bias when you use AI, when providing the care to everyone in the right way is very, very important. And then the privacy laws without compromising on the privacy of the person, without putting him in some other danger is also very important. HIPAA is one law that is there in US, privacy law. We have back home the Digital Data Protection Act. We are seeing the GDPR in the Europe. There is one in Canada. There's one in Japan. There's one in China. So using AI, the compliance with those laws is also becoming easier. Right. And then healthcare is also started using blockchain technology to be able to provide the data integrity, to provide the right solutions, and to be able to prepare ourselves for post-quantum cryptography world. And then the posture analysis for the entire enterprise has to be noted that cybersecurity, when you kind of ingest AI, right, into the logs, you kind of are able to generate lot and lots of data. And now, how do you use that data to get the right information to be able to avert a cyber incident? That is where the healthcare is again kind of the whole ecosystem is kind of targeting towards. And then the defensive platforms, tools like Vector AI, Darktrace, they are deployed in the hospitals. And what these tools do is they monitor the network. They flag anything that is suspicious, any malware that is coming in. And this way, they are kind of trying to avert a lot of incidents. So the idea or what is important for any technologist or a player in the healthcare ecosystem is right that invest in an integrated platform where ethical alignment and you being able to use the device in the right way is very, very important. This synergy of cyber and AI, right, is going to add trillions of dollars into the economy because the healthcare sector is bound to grow, and this growth is possible only when they are on cloud, they are using AI, and once they are using these, they are prone to more cyber attacks, and once they are and that cyber attacks can be averted only by using AI. So this synergy of AI and cyber is going to shape the world in the future and going to shape the technology growth in the healthcare domain in future. And so it is important that we technologists treat cybersecurity as a strategic enabler and not an afterthought. It is very, very important that all the organizations invest on integrated cybersecurity tools as a strategic investment and kind of do the risk assessment, help work out on their risk portfolio, and kind of don't push security as an afterthought. It has to be something that you kind of think even before you are thinking about what solution you are going to provide. And that is when you are able to be part of that growth curve that is being targeted. And now what is there in future? As I said, zero trust. We cannot trust anything. And then any technology that is zero trust, where encryption, authentication, multi-factor authentication, authorization, right predictive threat detection, and seamless scaling, all of that are the solutions that we have to work on. Agentic AI. Future is all about agentic AI. AI and agentic AI is not something that is that will come and go off. It is here to stay. And future is about autonomous AI agents that will emerge. In 2026, you will see a lot of those agents emerging to orchestrate all the real-time security responses, isolating your ransomware cloud-based workflows and augmenting clinical tasks. So all your clinical tasks, patient scheduling, treatment planning, and all of that is going to be done by agentic AI. And that is the future. So we have to be ready if we are not already and start investing in that. Platform consolidation for unified AI, cloud, and cyber ecosystem. As I said, we healthcare ecosystem is going to invest in AI for their own things like prediction, treatment plans, and all of that. Along with that, for all the cyber defenses also, the investment is going to happen on AI-driven cyber defenses. So that is the future. Edge computing synergy for secure low latency care. So edge is when you have local cloud, you have it is not the public cloud, but your private cloud. And that is also going to increase as the laws of privacy laws are kind of evolving across the globe. Edge computing is going to gain a lot of popularity and usage among the healthcare providers. And evolving governance and post-quantum protections. With quantum, lot of passwords are going to break, right? So all the healthcare providers are investing in post-quantum protection and the governance. The governance is evolving as we speak. There are laws going to come on ethical use of AI. There are laws going to come on digital data protection. There are laws going to come to avoid deepfakes. There are laws going to come how to use the personal information, how to manage consent and all of that. And it is important that we as healthcare ecosystem are aware of that and we kind of use these things to provide a better care for our end customers along with benefit to our business. With that, I'll take a pause and would like to take any questions that any of you have.
Thanks, Sivani. Yeah, we do have some questions, and let me pick up a few from the Q&A section.
Yeah, sure.
Yeah, we have Abhinesh asking, why is AI and cybersecurity together becoming important in healthcare?
Yeah, so as I told you, right, there are two aspects of AI in healthcare, which I was talking all along, right? One aspect is about how AI can be used to provide that care or to provide the right future needs, right? But along with that, the threat surface also increases as you start using AI to detect a disease, to analyze an image, to predict a patient health by seeing his past history and all. It also increases the threat surface because to do all that you have to be connected to the internet. The moment you are connected to the internet, your threat surface, the chances of getting into a cyber attack also increases, and the attackers are 100 times faster than the caregivers because they don't have to care about anything, right? They just have to do something. But we have to comply with laws. We have to comply with the law of the land. We have to comply with the process of developing a product and all of that. So we have some controls. They don't. So they are growing even at a faster rate. So it is important that we use AI also in cybersecurity to come up with intrusion detection, to come up with the right threat intelligent platforms, which will detect the threats and prevent them even before the threat happens, prevent a ransomware, or if a ransomware happens, if an attack happens, isolate that device so that the rest of the devices in the hospital or the rest of the solutions in the hospital can be used. All of that can be done or can be done faster using AI. Human cannot do it all by themselves. So that is why this combination of AI and cybersecurity is kind of gaining so much popularity.
I think there's a follow-up question from Vamsi who's asking something which you just answered right now. It says about how to reduce risks of medical devices connected to networks.
Yeah, so I told you, right, with the right threat intel platforms installed in the hospital network, with the right training provided to the hospital staff, that is like really, really important. With ignorance is what causes a lot of problems. These insider threats that we are talking about, the ransomware that usually happens, all begins, most of the cases begin when a hospital nurse or a hospital staff go and click on an email, a phishing email, and they kind of provide information to everyone. So it is important that the right training, cyber awareness is provided to the end hospitals. Like right threat intel ecosystem is there in the hospital network, and overall detection, uh, so that if something is going wrong or some attack is in progress, it can be prevented. It can be a notification can be sent, something can be done. So that
The
threat
incident
intel
reporting kind
also
of incident reporting mechanism is what you're talking
very
about.
important. Very
Yeah.
important. Yes.
Yeah,
Yes.
I think already one of them already spoke. They're talking about how ransomware attacks can be stopped. I think you covered that. So yeah,
They cannot be stopped, but you can prevent a lot and lot. You can
yeah.
not stop completely, but yeah, you can prevent by threat intel, by having a right incident report mechanism. But even before incident report, monitoring is very, very important. If you have the right AI systems that can monitor what's going on and can report if something suspicious is there, you can prevent a lot of attacks from happening.
We'll take one last question from Jayashree is asking what kind types of data are at the risk of cyber threats? What types of health?
Anything that is your personal information, right? Anything that's personal to you, your name, your address, your height, your health information, like are you detected with some condition, your blood report, anything that can trace back to you. So if I have your name, which is kind of available, and then I have your blood report, I can trace back, right? I can understand. So the bare minimum things that can go wrong is if I have low hemoglobin detected, suppose, and
Mhm.
I went for a blood test, CBC, the normal blood test, and I got detected that I have low hemoglobin. Now, what will happen is if that data gets leaked, and this is like the bare minimum thing, right? And that data gets leaked. Now, whenever I open YouTube, I will get hundreds of ads saying how I can improve my hemoglobin. If I open Google, it will talk about ads and devices that can monitor my glucose level, my hemoglobin level. And when you kind of get so many ads targeted to you, you will get calls of clinics that will say that, are you going to monitor your hemoglobin? Can we do a home collection of blood sample and all of that? And that is when you might go and click something. Some link would come as an advertisement, you click, and that is when you end up giving your financial information, and that is the vicious circle you end up into. So when I say what, when you ask what kind of information, it could be anything that is personal to you, your health report, your name, your address, all of that is personal.
We have one Manoj asking that he when he was at a tech summit and when he was conversing with the healthcare company, saying there are many sectors like to secure data of the clients like a red team, a blue team, and is there some kind of significance of the kind of tier system of where people secure the client's data? Something on those lines he's asking. I'm not clear what the actual question
So
is.
there is no tier system, Manoj, if I got the right name right. But red team is nothing but these are cybersecurity professionals.
Ah,
In cybersecurity domain, right? There are differentiation. There is a red team, there is a
red
blue,
hat, yeah.
right? So when I say this is red team, it is this is offensive security team. It will go and attack your systems. It will, but in an ethical manner, right? They will
Yes,
attack and they
yeah.
will figure out what can go wrong. This is also penetration test, but it is more of ethical pen test. Yeah, they will do without any knowledge of the system. They will try doing everything like black box testing. They will send you emails. They can do whatever they have, and they will try to figure out how the system is vulnerable so that it can be fixed.
Yeah, it's more
When
on
I say,
the red hat, black hat, and that kind of.
okay. Red Hat, Black Hat are nothing, but they are conferences where this ecosystem of security, um, companies, right? They kind of come together to share knowledge as to who is doing what, and they are red hat and black hat also refers to the type of hackers, right? Black hats are like really malicious and they are criminal hackers, and red hat are they are ethical hackers. So if I have a suppose I have a team, or I myself a hacker, I have done some penetration testing and I have done some course, and I kind of I'm certified penetration tester. What I can do is I can go and test my Apple phone. I can see if there is a bug. I can go and write to Apple saying that there is this bug that I was able to find, and this can cause problem. Can you fix it? Then I am a blue hat hacker. And because I am an ethical vigilant and I am kind of trying to fight the bad people. So I go and tell the organization. And mostly these organizations kind of provide money and all of that to such people. And they reward them, they recognize them, they provide them certificates and all of that. And then they kind of work on those issues. And red hat are the people who are like real hackers. They are the ones who kind of want to benefit from your vulnerable systems, if that answers your question.
Yeah, yeah. We have Ruben Money asking I think it's an obvious question. Compared to the US, the adoption of advancement in AI and cybersecurity in India, it appears to be very relatively low. Maybe lack of awareness, like that's what we are trying to bridge right now, doing webinars like this. So, what are kind of steps which we can take to bridge this divide? Is question. Yeah, it's a valid question.
It's a good question, and since I have been in this domain for a long time now, and I do interact with people in the healthcare ecosystem, right? So the adoption is not less in India, and in some places, right, it is much more in India than it is in the Western world, like the use of
Really?
apps. Yeah, like the use of apps, the remote consultation with the doctors, with the caregivers. Even my parents use remote consultation today, using Apollo app, or for that matter, Practo app and all of that, right? It is much more in India than in the Western world. Now, within the hospital ecosystem, the use of AI and cybersecurity, right? If you go to bigger hospital chains like an Apollo or Narayana Hridyalaya or Sakra, I'm giving all examples of Bangalore, but these are like really they use the most advanced ones. They invest their in their IT and all of that. Now, India is a country which has different, the ecosystem itself is very different, right? There is this rural part of our country, which is kind of a lot more vulnerable. And these are the people who are like more into trouble today because for A, they don't have awareness. B, they don't have enough. The investment in those 2 tier and 3 tier cities is very less. But in top tier cities in India, every chain is investing a lot, and they are doing it in the right way. And I can tell you, the government is very much aware, and because of the situation India is in with its own neighbors, right? Government is very much aware of what is the problems, and the adoption is very high. But the problem is we are such a vast country with such a huge
Yeah,
income
yeah.
gap and that spending capacity gap and all of that. So with Ayushman Bharat,
Healthcare
right?
in remote places. Yeah, healthcare in remote places is the biggest challenge, and now I have to deal with all of this stuff which comes as an offshoot from
That is why
providing
Ayushman
to
Bharat
the
a game changer. That is where Ayushman Bharat could be a game changer. That Aadhaar linking and getting that health IDs and all of that, right? It is going to bring in that remote care and all of that. And then government is also kind of spending a lot on healthcare nowadays because they have also realized that healthy citizens are going to bring them a lot more economy than sick people, right? So it makes a lot more sense for the
yeah.
economy to have healthy people around, and that is why government is also doing a lot in that sector. So we are not behind the Western countries, but our challenges are very different. We have a bigger poor people population, bigger people who depend on government subsidies, um, big lot
Right.
more cities that are not connected and all of that. So we are working on that, but yeah, it is going to take time. But
Yeah.
we are not
The
far
scaling is
behind. We are
immense.
not at all far behind.
Scaling is immense. Yeah. The scaling which we need to do cannot be compared to anyone else in the world. Yeah.
Yeah.
Yeah. One last question from my side, Shivani. Like, uh, like how you have the compliance of HIPAA compliance. Uh, in India, we are doing it something called DISHA, Digital Information
Disha
Security.
is not there anymore. I think Disha has been changed to DPDPA, right? They were about to come with a privacy act only for healthcare, but the government did away with that. And finally, the thing that came is DPDPA. The rules have come, and I think all of us have to comply with DPDPA now. Disha is not there anymore.
Oh,
Yeah,
okay.
so
Thank you
government
so
was
much,
planning a lot
Shivani.
of
It's been
things.
such a feeling conversation. Yeah, it's been such a freewheeling conversation, and thank you so much for taking your time out actually to give this session. It's been very informative, and I recommend all the attendees to look up Miss Shivani in the LinkedIn profile, and if you have any kind of questions, you can directly connect with her, and interact more with her. Yeah, and yeah, Shivani, saying something.